Me being good at my job doesn't mean a thing if people are having a troubles understanding their original Medicare services. So what I want to do is this. I'm going to explain the services that you do get with original Medicare, the services that you do not get with original Medicare, as well as the deductibles on each part. All right, so here's what usually happens. Now, each situation may be different, but typically this is pretty much how it happens. 3 months before you turn 65, you're going to receive an influx of mail by Medicare, basically just letting you know that you have the option of enrolling in Medicare because you are turning 65. Original Medicare consists of two parts. Part A is your hospital insurance coverage. So that's your Part A. Now, inpatient Part A consists of, here's a list here, inpatient care for a hospital, inpatient care in a skilled nursing facility, not custodial or long-term care. So let me clarify that. Custodial or long-term care is not a part of Part A. Hospice care is covered, and most people are not aware, but Part A does cover inpatient care at a religious, non-medical institution. Now, if you've worked over 40 quarters, which is roughly about 10 years, then there is no premium for you to pay for your Part A. Now, if you were married and you didn't work, you may be eligible to use your spouse's quarters for your services or for you to get your Part A. There are some factors that you might have to look into. So if that's your ordeal, you need to look into that. Now, there is a Part A deductible that has to be met before Medicare starts to pay, and that deductible needs to be covered per occurrence. Example, if you have an incident in February that has you going to the hospital, you'll have to pay that deductible for Medicare to meet their part and do what they need to do, and so everybody can be happy. And then let's say you have another accident in August, or you're going to need to pay that deductible again before Medicare takes over and they pay their part. And then there's Part B. Part B is your medical. Your Part B consists of things like, it's going to cover things like your primary care physician, your specialist, but it's also going to take care of things like your outpatient services. Let's take here, home health care, your medical durable equipment like your wheelchairs, your oxygen tanks, your walkers, your home health screenings, your yearly annual visits, vaccines are covered also, but that's not all. There's a whole list of things that you'll give them when you give them your red, white, and blue card and you want to see your Part B. There's a list. Let's take a look here. Acupuncture for people who do that type of thing. Alcohol misuse screening and counseling services, bone mass measurements, chemotherapy, CPAP devices, cardiac rehabilitation, diabetic services, or diabetic equipment, shoes and supplies. Let's see here, some type of screenings here. Part B, I put it this way. Part B covers a lot of the services that you're going to need. Now, Part B insurance does have a deductible that needs to be met before your Part B pays. Now, it also has a premium. Now that premium right now, what is it? $170.10. It's coming out of your Social Security check right now. At this particular time, I think it's $170. Yeah, I think it is $170.10 that's coming out of the Social Security checks. If you allow them to do that, there's some people who don't want to have that money taken out, so they don't have their Part B. To each his own. You do need to, let me make sure I have this right. The $170 is being deducted out of people's Social Security check. Now, they have what's called a Part B give back, and certain insurance carriers offer to put some of that money back into into your account that whatever Social Security takes out in certain zip codes, in certain areas. I want to make sure that we understand that it's in certain areas. It's not across the country. It's in certain areas. So if that's something that you may be interested in, I would strongly advise that you look deep. I would advise that you speak with a Medicare agent, not a licensed Medicare agent. That can go over different plans that might be suitable for you. So I'm just going to leave it right there. Okay, so this is what you're going to need to really understand when it comes to Medicare Parts A and Part B. Medicare is only going to pay 80% of the bill, period. You're going to be responsible for the rest, which is that other 20%. And it's uncapped. Okay. So if your bill is $10, $20, or even $100,000, they're only going to cover their 80%, which means that you're going to be responsible for that other 20%. And also understand this, Medicare is only going to cover what they're only going to cover the expenses that are approved by Medicare. That's really important to remember because if you, I'll put it this way. I've had a lot, not a lot of people, but there are some people that I know who have filed bankruptcy because they were under the impression that Medicare will take care of any service, all of their services, just because they're over 65. They had to learn the hard way, but that's not true. If it's not approved by Medicare, Medicare will not pay for it. They're not going to pay their 80%. So that's another thing that you'd want to, understand before you start doing any medical procedures. I would check and see if that's going to be covered by Medicare, or they're going to do their 80%. Now, for people who have group coverage through their employer or their spouse's employer, here are two options that's for you. One, you can sign up for your Medicare Part A only, which is the hospital coverage 3 months before you turn 65, and hold off on getting your Part B started. Or option two, decide to decline all Medicare options 3 months before you start to lose your group coverage. Now, the one question I get a lot from people is, do I need to sign up for Medicare if I go through the VA? Now, not talking about TRICARE or TRICARE for life or anything like that. We're just talking about the VA only. Here's my answer. You will still need to enroll in a Part A, but not your Part B. You would just have to go to VA doctors if you don't want to pay for anything. And I understand a lot of people hold off on getting their Part B set up because they don't want the money coming out of their Social Security, or they're still working, or they have retirement benefits already set up and they never got around to setting up their Part B. So there's several different reasons and why people don't have their Part B set up. That's, again, to each his own. So that's it in a nutshell. Medicare Parts A and Part B, your red, white, and blue card. Now, you can get Medicare not just only by turning 65. If you have SSDI, which is disability income, Social Security disability, SSDI, then you're eligible for that if you have been on disability insurance for 24 consecutive months. So I wanted to, let that be known that this is not just for people who have turned 65, but it is you're eligible for it if you do have SSDI also. So same things apply to you. The one thing I also wanted to touch on is your Part D prescription drug. That's a whole nother can of worms that we're going to discuss at a later time. Health insurance is a rabbit hole. And it's a rabbit hole. It'll drive yourself nuts trying to figure it out. But my goal is to try to make this as easy as possible for you. And so it won't be a big deal. Until next time.